In this slide, I will be going over the case study. Our situation takes place in a hospital where a 68-year-old female was admitted with a diagnosis of GI bleed. She has history of anemia, atrial fibrillation, and is diabetic. They took some lab work and the results came back showing that she had a hemoglobin of 6.8 and hematocrit of 21.4. Doctor's orders were to transfuse 2 units of packed red blood cells and pre-medicate 1 hour before with Tylenol and Benadryl. During the day, the patient had two nurses. One of them was a seasoned nurse, and the other one was a new grad who was training under the nurse. They were able to transfuse 1 unit of PRBCs during the day shift. When night came, a change of shift, they spoke to the night nurse. The night nurse said she was receiving report from the new grad, while the preceptor was in and out of the conversation. Reason being is that the hospital had a new computer charting system, and she was assisting other nurses deal with the new system. So she took report and they told her how to pre-medicate the patient. The night nurse did her end note, as all nurses are encouraged to do a opening note and an ending note when after change of shift. So the night nurse, took care of the patient during the night. When day shift came back, change of shift, it was a different nurse who was about to take care of the patient. She noticed that the orders were there for 1 unit of PRBCs to still be transfused. The night nurse was distraught. There was a couple of problems that started with this scenario. So the one who gave the report, the seasoned nurse with the new grad, said that she endorsed the 1 unit of PRBCs to be transfused, while the receiving nurse, which was a night shift nurse, said that she wasn't informed. All this came to be a couple months later. The new grad was actually no longer there, and when she had given this report, she had been there for just a couple of days. There was another problem. The system was new, the nurses were confused, and some of them were still not sure about how to navigate through this new system. So all this resulted in a delay of care. The patient was fine, but the unit was transfused late. There was some disciplinary actions that took place, and definitely a learning experience.